Hey there, it's Rochelle here from Soundscaping Source. This video is for hospice chaplains. I'm going to give you some key indicators to look for to identify a need for a music therapy referral among the patients that you serve. Now, as the chaplain, you are the expert in spiritual care. So I am looking to you as a music therapist, I'm looking to you to understand patients and family members' religious experiences, as well as their thoughts and experiences related to the big existential issues and the big like life and death and relationship issues that are so, they're important throughout life, but they're so important at the end of life. You as a chaplain are aware of that and you know what's going on there. And so I'm coming to you as a music therapist for understanding about what's going on with some of those big existential transcendent issues for people. As a music therapist, I'm here to help patients and families to have meaningful music experiences together, to enjoy in the here and now, as well as to hold all of the big stuff, all of those existential and transcendent kinds of things that come at this sensitive time of life. So people are dealing with some really big things, and music can be a good container for that. As a music therapist, I can help to give patients and family members these experiences that can help them to confront these big issues and to find a way to feel comfort and to feel peace. Exactly what you're interested in as a chaplain. So we have, as a chaplain and as a music therapist, we have a lot of overlapping perspectives and a lot of things that we are addressing together as far as the psychosocial needs of patients. And so I'm always grateful to be able to talk with you, with chaplains, about what's going on with patients and their big spiritual and existential and transcendent needs. So some of the key indicators that you're going to want to look for as a chaplain to refer somebody to music therapy. First of all, anxiety and depression and grief, some of those uncomfortable feelings that people deal with. As music therapists, we have training and understanding to be able to honor those feelings within the music and to help people process that and to find a way towards comfort and peace. Okay, so identifying people who are experiencing a lot of anxiety, depression, and grief, that's a key indicator for a music therapy referral. Loneliness and isolation are also good reasons to refer to music therapy. Music is a communal medium. It's something that we do together. And even if it's just the music therapist and the patient in the music together, we're connecting with the wider world, with their personal history, with their family members who aren't there. Music is something that helps to bring people out of that isolation and connect with the bigger world. So especially when they can't get out of their house, it's something that can help them with that. Another key indicator is confusion or agitation or a dementia diagnosis. When there's that cognitive limitations going on, music is something that can have an organizing effect. And as a music therapist, we know how to design those music experiences to help people get more grounded in the here and now so that they can connect with the people around them and to feel that connection, to have that social interaction, to feel safer in the space where they are with the people who are caring for them, and to bring up those long-term memories and those good feelings from long ago so that they can have that joy and that fun and that peace that is part of a good quality of life at any stage, but particularly at the end of life. Another key indicator to look for, especially as a chaplain, are for people that have a need for nonverbal communication. So people that have, everybody has these emotional needs that we need to deal with, and these big spiritual needs and existential issues. But for somebody who doesn't want to talk through that or is uncomfortable talking through that, that's a good reason to refer to music therapy because we can do a lot of that work in the music. It's also true for people who no longer have speech because of a neurological impairment or an injury or a dementia process. For people who can't communicate verbally or choose not to process a lot of things verbally, that can be a key indicator for a music therapy referral, so we can do a lot of that communication in the music. Another key indicator for music therapy is when there are complicated family dynamics or when there is a need for extra caregiver support. Music is one of those things that helps people connect and that gives somebody a joyful experience and a beautiful experience. Even if there's tension going on within a family or if there's tension between caregivers and the hospice team, music therapy is one that we can help to smooth over some of those rough edges and to build those bridges and help people to get together more harmoniously. See how that's a musical term? Build harmony there. So that's another good key indicator for a music therapy referral. Another place where we build bridges is for people with difference in cultural background. So if there's a cultural barrier because of a difference in language, or for somebody who has a significant cultural experience that is not the dominant cultural experience, by interacting in the music of that person's culture, we can help to build bridges so that person feels more supported by the hospice team, and so that that person can feel more trusting of the hospice team as well. And of course, we're addressing their quality of life needs and their needs for connection and understanding through that as well. So a cultural barrier or a different cultural experience is another good key indicator for a music therapy referral. And finally, for somebody who had an especially significant relationship with music in their life, that's a key reason to refer to music therapy as well. Now, it is not a requirement that somebody is a skilled musician or they have a lot of music experience to benefit from music therapy. So don't feel like that's a reason not to refer. But for somebody who who was a performer or a teacher or who played the piano for years or who sang in a choir, who had music as an important piece of their life, we want to continue to honor that at the end of life as well. So that is another key indicator to refer to music therapy when somebody had a significant personal background in music. All right. I hope that clears up some of the key indicators to look for when you are referring to music therapy. Just to go over them again, looking over my notes. Key indicators to look for: anxiety or depression or grief, those difficult feelings that we can help to honor and address in music. Loneliness or isolation, confusion, agitation, dementia, a need for nonverbal communication, whether it's because they don't want to process verbally or they're no longer able to use speech. Complicated family dynamics or the need for extra caregiver support. A cultural barrier, cultural needs, and then for people who had a significant relationship with music earlier on in their life. Those are all key indicators to look for as from your expertise as a chaplain to refer somebody to music therapy. Now, I just want to say thank you for everything that you do as a chaplain in hospice. Looking to people's spiritual care is so important at this sensitive time in life. I have great respect for everything that you do as a chaplain and serving on the hospice team. I look forward to working together with you to serve our patients and to bring them the quality of life that they deserve at the end of life. Please let me know if you have any questions, and I look forward to your referrals.